taking that another step with gender identity.
Oh my gosh. Yeah.
And your talk about endocrine disrupting chemicals. Well, we know that certain foods that a pregnant woman will take in or alcohol will disrupt the DHT and the testosterone that helps to regulate the brain to decide on gender assignments, self-assignment. And I'm thinking through this recent occurrence of these gender identity issues, and could it be from all the endocrine disrupting chemistry that's in our environment, in our foods, that parents are pregnant women are taking that are leading to the children, their offsprings, having these chemical abnormalities or hormonal abnormalities that create the personalities, thinking that they're one gender versus the other. I mean, that's rhetorical because
yeah, Dr. Shauna Swan makes a big case on this, and it's it's funny that you should say that, because it's a very politically charged, very emotionally charged subject, especially nowadays. I mean, and these are scientific researchers that are actually seeing this on on the research.
It's a question between someone making a conscious decision to be another gender as opposed to the deficiency of the hormones that allow us to establish a specific gender, which is lost. It's blurred.
Right.
So then they're trying to figure out which one, and they choose the one which fits them biochemically.
Right. And again, the test that we took, you talked about the test, but we didn't tell him. So Dr. Mark has a Millennium company where he treats hormonal insufficiencies based on TBI a lot with veterans. And it's about neuro-endocrinology.
Yes.
Endocrinology to me is one of the hardest sciences in medicine because, again, our body, our hormones determine who we are. And our hormones, it's not an exact science. Right. Endocrinology is not a science of number. It's a clinical science. Right. So endocrinology nowadays, it's numbers. You'll see the regular endocrinologists, they'll tell you, if your number's above this, you're fine. If it's below this, it goes way beyond this. So to be able to understand the complexity of the endocrine system and what's going wrong with it, because most of those toxins that are endocrine disrupting chemicals, they're mostly estrogen based. They're estrogenics. And I feel like this is why men are so victims of this. And we're seeing it in our society. We're seeing that.
Well, I think it's a great opportunity to go, now that we know you're the TBI expert and the cascading effect on our endocrine glands, the use and administration of hormones for longevity and overall well-being. Let's talk a little more about hormones, because that's what we specialize in.
Right. Well, there's one of my mentors from USC, Dr. Caleb Finch, wrote a book on neuroendocrinology and longevity. And what he clearly stated is that when you lose the hormone production in the brain, systems start breaking down and increase or decrease your longevity and increase your disease states. So in looking at hormones and how they influence the body, I mean, most of us look at estrogen, progesterone, testosterone as being gender hormones or sex hormones. Well, it turns out they have what's called pleiotropic effect. Pleiotropic means many different effects. So we can't talk about testosterone just being, for great libido or reproduction. Right. We have to look at other aspects to it. Well, one of the aspects that I look at in the area of neuroendocrinology with the brain is the fact that testosterone stimulates the immune system. It increases the defense systems. Testosterone also helps to modulate and alter inflammation that might occur after a traumatic brain injury. It's very important for lowering inflammation and increasing anti-inflammation products. Estradiol helps with the elimination of the cause of Alzheimer's disease. We call it beta amyloid, and it helps to get beta amyloid, this inflammatory chemical, out of the body, out of the cells, so the cells can repair. And if you go through every single one of our hormones that are produced in the brain, you'll find that they have incredible effects on our personality, our behavior, which we call neurobehavior. And one of the products, which is called pregnenolone or allopregnanolone, is antidepressing, anti-anxiety. It helps to remove the inflammation from the brain and stimulate brain healing.
Is that why? So I'm going to tell my personal story. So my main testosterone deficient symptom was chronic mental fog. I mean, crippling mental fog, right? And
At what age again?
in my early 30s.
In your early 30s.
In my early 30s. And by the way, this was, for a long time before that, and that's why I was prescribed, Ritalin and then Adderall and all these things. And so for me, and just as a sort of like common pattern, Doc, and I think you could attest to this, is one of the typical comments that we get, which is magic for us. I mean, we get a lot of job satisfaction where we take a guy, we put him through a program, 6 to 8 weeks later, it's like a completely different human being, right? I mean, because we get them from when they call in and they're angry and they're rude and they're not very resourceful to then 6 weeks later, oh my God, you changed my life, right? That type of thing. But one of the typical comments that we get is like, Doc, it's like the lights came back on.
Yeah.
It's like that mental clarity, and that's what I always try to tell our patients is like, hey, it's not about the muscles, it's not about the sex, it's not about all this stuff, even though those things are great, right?
Yep.
We love those, but it's about the mental clarity that you get. So can you kind of like explain the science behind, like, why does that happen?
Yeah. If you look at testosterone, for instance, it lowers 4 very damaging inflammatory chemicals. Now, why are these inflammatory chemicals so important in the functioning of the brain? It's because these inflammatory chemicals interrupt chemical processes, chemistry going from A to B product to stimulate nerve conduction. So inflammation will inhibit the ability of one chemical to convert to another that you need for quality brain functioning. Also, there are receptors, which are areas on the cell that receive a hormone to do its work. So if you don't have these receptors and you have, let's say, testosterone will be floating around. It'll never find a home to sit in to work with your brain. So cognitive impairment, which is the fogginess that you talk about, is inflammation that causes disruption of the conduction of impulses. So when you got the testosterone corrected and possibly the other hormones that help support testosterone, what happens is you start, clarity, cognition. We have in our veteran community guys that can't remember, what they had 5 minutes ago. And when they're put onto treatment to lower the inflammation and improve the hormonal levels in their body, they start being so crystal clear, they go back to school and we've got 2 guys who got physician assistants. We have my partner who went back and got a MBA from Pepperdine. He wrote a book that became the movie Quiet Explosions. And before that, it was dull. Because the chemistry wasn't working. And one of the things I want to say that, comment on that you said that's right on. We do not treat numbers. We treat people.
Patients.
People, patients, clients.
Human beings.
Humans.
Stuck on lives of paper.
We
like
treat
to say.
lives.
Numbers are just giving us an understanding of at what number this
good at.
person feels the best.
Yes.
So, in traditional arenas of medicine, they have this fixation that if you fall between A and B, then you're okay. So for instance, if a range of one particular very important hormone, whether it's testosterone, growth hormone, thyroid, or whatever, is between 10 and 90, if you come in at 11, they're going to say, you're fine. And you say to the doctor, but doc, I don't feel good. They said, that's because you're depressed.
That's
That's it.
It's almost like saying whether you hit the bullseye or the outer edge of the target.
That's right.
Whether
You're
you're 25 or 80 years old, you're okay.
That's
Which
right.
is crazy.
Yeah. And
right?
that's another great point. In laboratory sciences, which I work a lot in, it's for different age groups, they have a lower level of hormones. Like someone who's between 25 and 35 might have 100 as being normal for them. But someone like me at 70 years of age, a level of 60 is acceptable as being normal. But that is not the truth. The question is, how did they determine that at 25 to 35, 100 was good, and at 70, 60 is good? And that's based upon doing levels at different decades, at 50, 60, 70, 80, and looking at the average that occurs. And they're saying, that's normal. And I said, that's not normal. What it is as we live longer, we have more damage to our regulatory hormonal system in the brain. So what happens? As we live longer, the levels go lower, not because of our age or genetics, but because of the traumas that we have on a daily basis.
Wow.
And our environment, right?
And
Like
our environment.
Our environment.
The
100%.
accumulation of all
the,
this.
100%.
yeah, the endocrine disrupting chemicals, the
Electromagnetic field
I
now
do
you
martial
have.
arts, or I shoot shotguns, in Texas and so forth. And
And it's funny. It's almost like and it's almost a sort of like a mounting effect, because as these things go, so the health stage of our
Correct.
population
Correct.
continues to decline and decline and decline and decline, which is why some of these Reframing ranges have been lowering over time as well.
Right.
And so it's like we have a entirely hugely super sick population, and you're saying, well, in comparison to them, that's normal. Well, that's not my normal.
that's right.
I don't want to be like that.
I don't want to be like
Back
that.
in the day, it was like 800. Back in the 60s, what we like to
Right.
tell people, and you have a 30-year-old like myself come in and be at 400, and my doctor tells me, hey, you're
Yeah,
okay?
yeah.
In comparison to what? To
Yeah.
right?
Yeah.
So-
Absolutely.
One thing I wanted to say to go back, I love the way you explain how testosterone decreases the inflammation in the brain. And again, I read your book.
Yep.
I love how
We.
you call it. We are.
Did you guys get
Collectively.
together?
Together.
Night reading
And like
Let's
last
read
night?
out one
it is
word.
the hardest
Yeah,
book I've
took
ever read
notes.
in my life.
Took notes.
Okay?
But the way you explained it was, I loved it. You said that it was the neuropermissive environment.
Yep. Yeah.
And when there was inflammation or a TBI, it was a non-neuropermissive.
Correct.
And I love that word, permissive.
Right.
It permits better communication in the cells.
Correct.
It allows for better communication. So it makes sense now why a hormonal deficient or an inflamed brain is a non-neuropermissive brain
Correct.
that will not allow you to think clearly, to be the best version of yourself.
And inflammation is so easy. Like, I love your forest fire analogy. It's great, because that's exactly what it feels like. And you know what? The inflammation, you and I have talked about this. When you're with mental fog, it almost feels like your head is big
Yeah,
and inflamed.
yeah, it's
it
hard.
actually feels like that.
Talking about inflammation, and to share a study that you shared with us a while back, that using patients that had higher testosterone levels in comparison to those that had low levels of testosterone had a higher survival rate. So can you talk a little bit about how hormone therapy improves your immunological function and resiliency?
Yeah, well, what we're finding is all the hormones do positively influence our immune system, whether or not it's the B cells making the antibodies or the T cells defending us from attacks from viruses or from mold or cancer for that matter. What happens is it increases a set of cells called CD4 and CD8 cells, CD4 plus and 8 plus, and those are the ones that help to protect us from invaders. And people die from, simple bacterial infections. People get a common pneumonia and they die. Why does that happen? It's because their immune system is off. In this recent epidemic that was going on, it turns out that that particular strain of virus would increase the accumulation of our white blood cells in our lungs. And the white blood cells are helped to fix things and keep the bacteria and viruses at bay or destroy them. But what this specific virus did was cause the white blood cells to accumulate in the lungs so that they all together dropped cytokines to create what everybody knows is called a cytokine storm. And that cytokine storm is what caused us to lose our lung functions, hypoxia, low oxygen, and die. Well, it turns out that one relatively minor perceived hormone, it's very important for us, but across the spectrum of traditional medicine, DHEA actually increases a chemical that protects your lungs from that COVID storm. So that's one very specific means by which the DHEA, a hormone, increases something called DEL1, which protects the lungs from all the white blood cells accumulating in it, dumping their inflammatory chemistry, causing the ability to exchange oxygen and carbon dioxide to go to zero. So you actually die from suffocation.
Suffocation. Yeah.
Wow.
Yeah.
And it's
interesting.
amazing that you can
It's-
remember all of
yeah,
those
like-
pathways and all of
And he's
those
70.
amazing complicated.
Okay, he's 70.
This is amazing. that you're always in awe.
I practice what I preach.
Yes.
And I've
Oh,
been-
yes, you do.
Yes,
Yes,
you
you
20
do.
Yes,
Yes,
for
you do.
29 years, and I don't share it very much, but I had 6 traumatic brain injuries from martial
I
arts,
didn't know
car
that.
accidents, and whatever. And when I reached my mid-40s, I ended up getting on antidepressants. And one of the reasons for why I'm here in this space, educational space, is because I'm a reader. So my escape was reading. And so I read and I found this couple articles that associated trauma with hormone deficiency. So I ran and got blood tests. And I was deficient in 3 of the 4 major hormones, growth hormone, testosterone, and thyroid. Wow. And within 90 days of replenishing it, it was like my world, as you were saying. Yeah. You woke up.
Yeah, the lights came on.
And that was in 97. And then I started doing this very intense reading, and then by 2004 was committed to the area of neuroendocrinology and started seeing how trauma, reduced hormones, increased the occurrence of all these psychiatric conditions.
Wow. So let me think about something. 1997, you did the blood test and you're a doctor. So when you went to see your friends to tell them, I'm not feeling good, help me out, did anybody check your hormone levels?
No.
Right?
No.
So you know what we call that? Medical gaslighting.
Yeah.
You were gaslit, my friend.
Well,
but thank God you can read. You went and did your research and you helped yourself.
Having happened in, not to dispel, I agree with you. I like it. I like it. I like it. Medical gaslighting. But back in the 97s, endocrinology was only a reactive.
Completely.
Reactive, meaning that if they found that you were diabetic, okay, give them insulin. If they found you were low in thyroid, okay, give them thyroid. If they found that you were depleted in testosterone, give them testosterone. So it was reactive. What we all sitting here do is proactive. And in proactive medicine, what we do is we look for the deficiencies of your hormones and we look at how they influence your quality of life. And if we find the correlation between low this, and it doesn't have to be 0, it can be just be relatively low for you. I don't use the scales that are traditionally in medicine to represent my patients. What I do is I see their number and ask them how they're doing relative to things we know about those particular hormones. And if their response is not good, we'll increase that hormone and then find out how well they're doing. And with every one of the hormones, from growth hormone, testosterone, thyroid, estradiol in the females, progesterone, pregnenolone, and so forth.
You know what, and that's really cool. I want everybody at home, that's watching us, listen to that, because so many people, and it's not a fault of their own, that's why we're here.
Right.
But they get their labs back and certain things are in the red and they're like, oh my God, is something gonna happen to me? My testosterone is too high. Too high in comparison to what? My estrogen's too high. I'm gonna grow boobs. What?
One of the funniest things is, have a woman come in and we run a 28-point biomarker panel. And that is very significant for finding all the endocrine, neuroendocrine disrupting issues, as well as the effect of trauma on the brain. And so I'm going through the hormonal results, and then I go to testosterone and say, your testosterone's low. And most women would say to me, I didn't know women had testosterone.
That's
It's magic for them, by the way.
Oh yeah, it is magic. And I said, okay, and you let them know that estrogen that runs through their body comes from testosterone. You need testosterone to convert to estrogen and estradiol and so forth. And it's, you need to educate everybody so that they understand that all the hormones in a male are the same hormones in a female, but at different levels and different ratios.